Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. Here are some of the highlights this hour. NSAS protests grind activities to a halt in Lagos as governor announces curfew to start 4 p.m. The United Kingdom pushes to be the first country to carry out human challenge studies. The Nigeria Center for Disease Control, NCDC, has announced that the COVID-19 Nigeria Situation Report will now be published weekly. It says the Situation Report for week 42 has been published on the website, featuring a breakdown of COVID-19 general data by states, the epidemic curve, the demographic analysis and response activities. In the meantime, the center has been reporting its expansion of the coronavirus testing laboratories in its network since the first outbreak of COVID-19 in February. The NCDC reports that from 3 centers in Lagos, Irua, that's in Edo State, and the Federal Capital Territory, it has, as at the 16th of October, expanded to 68 laboratories in its network in the 36 states of the Federation and the Federal Capital Territory. And this includes a combination of PCR and gene expert laboratories. While the global numbers of COVID-19 has passed 40 million mark, the USA, India, Brazil, Russia, Argentina are the top 5 with over 1 million cases. Nigeria recorded 118 new cases that were reported in 10 states, including the Federal Capital Territory. Lagos reported the highest with 51 cases, followed by Rivers, 26. Imo recorded 12 cases, Osun 8, Plateau 6, the FCT 5, and you can see the other states there, Kaduna, Ogun, Edo, and Niger State. Till date, 56,697 people have recovered and 61,558 cases are confirmed. We have the death toll still at 1,125, as no death was recorded in the last 24 hours. For the center, it is still a multi-sectoral national emergency operations center, EOC, that's activated at level 3. It continues to coordinate the national response activities on the coronavirus in the country. Now, a 24-hour curfew has been announced by the Lagos State government to begin from 4 p.m. today. A decision made by the governor, Babajide Sanwo-Olu, explains that it's as a result of the continuous NSAS protests across the state, which he says has become chaotic. According to him, I have watched with shock how what began as a peaceful NSAS protest has degenerated into a monster that is threatening the well-being of our society. Lives and limbs have been lost as criminals and miscreants are now hiding under the umbrella of these protests to unleash mayhem on our state. The state government adds that only essential service providers and first responders will be allowed to move outside this time frame. This is coming on the heels of the latest attack on the Orile-Gomu police station, which was set ablaze by hoodlums. Staying in the metropolis, hoodlums earlier today attacked the Orile-Gomu police station, setting it ablaze. Sources close to the police command say there were attempts to attack the Ebutemeta police station, but it was repelled. The acting head of the Lagos Fire Service, Mrs. Margaret Adesheye, says they were unable to make their way to the police station owing to the gridlock.
This billowing thick dark smoke coming from the Orile Gamon police station in Lagos gives a vivid picture of an outcome of terror unleashed by hoodlums who took advantage of the NSAS protests. In their hundreds, they attacked the police station, setting it ablaze. Anyone found around this vicinity who perhaps does not buy into their vision was also visited with anger. It was a mob action and definitely not the mission of the NSAS protesters. In Jos Plateau State, hoodlums also took over the streets, attacking innocent citizens who had left their home early, not knowing what was coming their way. They scamper for safety. Some journalists were not spared in the melee. In Edo State, a major highway was blocked.
The police are on their way. The police are on their way.
Shop owners and civil servants sit at home. Oyo State witnessed some tension as hoodlums also seized the opportunity to foment trouble. The NSAS protests may have started with a lot of genuine demands, which government in turn says they are looking into, but the situation in Orile, Ibutemeta, Jos and Benin City run completely different from the NSAS mission. And perhaps this may just be the time for the protesters to review tactics so that their demands are not wrongly interpreted.
Well, the protests still continued in other parts of the country, like Benue, Taraba, Enugu, Ebonyi states. But joining us now is a public health physician to take a closer look at the risk assessment while the mass gatherings continue across the country. We have joining us via Skype, Dr. Shalom Oni. Glad to have you on the program.
Yeah, thank you, Millicent. It's nice to be here.
All right. Hope you are staying safe. Do you suspect that there might be ongoing community transmission with some of the gatherings we've been seeing in the large numbers across the country? Because from the Presidential Task Force briefing yesterday, the Secretary to the Government of the Federation said as much. So that could be ongoing.
Exactly. Actually, that is the fear of everyone in the health sector because the COVID-19 is still there with us, still ravaging in Europe, even in Africa. And Nigerian has not been left out, even though our cases seems to be coming down. By and large, the number of gatherings we've been having, many of these protesters are not on face mask, not aligning with the non-pharmacological interventions. It's a cause for concern, really. So, well, it's yet to be seen in the coming days. I think as soon as we ramp up testing, we'll be able to know what exactly. So we're expecting some degree of spike, as far as COVID-19 cases is concerned, especially in Lagos, that has been the epicenter of COVID-19 and the epicenter of the end SARS protest. So we are waiting to see what's going to happen.
Interesting. Some people might say testing under these circumstances might not be possible, but remind us about the lifespan of the SARS-CoV-2 virus, especially when someone gets to emit symptoms of the virus. At what point in terms of the days?
I agree with you that testing might be difficult in this season because right now there's a curfew and, COVID-19 testing and sample collection in all the local governments and LCD become difficult right now because you can see what happened to Ajeromi local government right now. In fact, all the PHEs are also scamping for safety, really. So because it's going to be safety first for all the health workers. So I agree with you that testing and sample collection, to be taken to the molecular labs may be a bit difficult because even the logistics may be hampered. We've seen road blockages in the last couple of hours, last couple of days also. I agree with that. By and large, we shouldn't forget, as a way of reminder, that the symptoms for those who are going to be symptomatic for COVID-19 virus, it starts from 5 days, and from 5 days, the symptoms begin to show, and from there, for the virus stays there for the next for 14 days, before you begin to have some degree of, resolution. So we for what has happened in the last 14 days, or what happened in the last 11 days as far as the protest is concerned. So if you go by the lifespan of the virus, today appears to be like the 11th day of the NSAS protest. So in about 4 or 5 days from now, and as we ramp up testing, we should begin to see, some degree of spikes in Lagos, in Benin, in Port Harcourt, in Jos, in area, even in Kano, where these NSAS protests has really taken shape.
All right, today is actually the 14th day. In some other states, it's a little less. But let's go over to some of the figures that Africa as a continent is recording. The Africa Center for Disease Control director talked about how the healthcare should be there should be a new public health order for the continent, viewing, of course, what we've learned from the coronavirus. And he says it must stand on 4 pillars: strengthening the healthcare institutions with regards to manufacturing of therapeutics and diagnostics, also strengthening the health workforce and local and international partnerships. What's your take on how you think Africa as a continent, and using Nigeria as a case study, can resolve this, strengthening our public health system?
Well, I think this is a golden opportunity, for Nigeria and Africa. We cannot always depend forever on partners to develop us. This is a time for us to see what we can do in terms of strengthening services at the primary level, the tertiary level, and the secondary level. I'm talking about the primary level, talking about the primary health centers across Nigeria and across Africa. We must begin to, in area of infrastructure, we must begin to build more primary health care centers now that are closer to the people. Right now it's time for government to begin to look into wards, into villages, into communities, where there are no traces, of primary health care facilities there, and begin to institute one. We've done a great job in Nigeria as far as molecular lab is concerned, but then when it comes to the primary health care centers, we need to do more in Nigeria and Africa. That's number one. Number two, in terms of funding, Nigeria and Africa must wake up. Their budget, the 15% of their national budget, must actually go to health. Right now in Nigeria, we are still struggling with about 4, 5, 6% of our annual budget. So right now is the time for us to move to 15% according to Abuja Declaration. That's number two in terms of strengthening services, as far as the building capacity to be able to combat future pandemics. Thirdly, we're talking about personnel. We must look for a way to increase the capacity, train staff, and not only that, recruit more across board. Doctors, more nurses, more community health workers, more pharmacists, more laboratory scientists and technicians. We must do this, across board, in the coming months, in the coming weeks, in the coming years, so that our health sector can be well strengthened. So these are key areas I think we need to do, going forward. And even this COVID-19 has given us that opportunity to be able to do that. So for me, I think we cannot depend on grants forever. The budget have to speak now. Nigeria is about to present 2021 budget. I hope the 2021 budget that's been about to be presented in Nigeria and at the Senate, contains 50%, for health. If that's not the case, I will be soliciting, that should be looked into right now, because COVID-19 is still with us, and only God knows what pandemic we'll be facing in 2021 and 2022 and beyond. So this is a good opportunity for us to build capacity across board. All
right, we appreciate your time. Thank you so much, Dr. Shalom Oni, public health physician. Thank you for joining us on the program, and stay safe.
My pleasure to listen. Thank you very much.
We have more on the COVID-19 updates when we return. Please stay with us. The Nigerian Medical Association NMA Kaduna State Branch has called on both the federal and state governments to allocate not less than 15% of their annual budget to the health sector in order to strengthen the sector, especially in the face of the pandemic. Chairman of the Medical Association, Dr. Liu Sokumba, who made the call in Zaria during a news conference to mark the 2020 Physicians Week, frowns at the nation's weak health system in the country. He notes it is largely due to inadequate funding. Describing the situation as totally unacceptable, he says if Nigeria must effectively combat the scourge of COVID-19, he says that medical personnel should be better paid, as well as, of course, which would definitely stop the massive brain drain and promote less medical tourism, especially among the elite class.
The Nigerian doctors frowned at the overtly obvious weakened health system, especially in the face of COVID-19. And we are urging all these relevant stakeholders to play their part to see that this COVID-19 pandemic becomes a turning point to strengthening the health system in the country. As you are aware, one of the fundamental reasons why we have continued to suffer this current weakened health system is the fact that the budgetary allocation to health as it stands even in 2020 budget is far less than 5%, as opposed to the 15% budgetary allocation. And you know basically that everything becomes possible with funding. So we are urging the federal government, the state government to implement the Abuja Declaration of budgeting 15% budgetary allocation to health. And that way, I believe the health system will be strengthened.
Joining us right now is Dr. Peter Emuassie. He's a research fellow at the University of Aberdeen. He joins us now via Skype. Thank you for joining us on the program. Before we talk about therapeutics and vaccines, potential vaccines for COVID-19, I'd like to get your reactions on what we're witnessing across the country in Nigeria, especially with the mass gatherings.
Thank you, Millicent, for having me. Regarding the mass gathering we have in Nigeria and as regards to the end SARS protest, I think basically we've kind of given COVID-19 the opportunity to spread among the population, despite we have low cases when it comes to people with COVID-19. But be that as it may, we've kind of given a leeway for the virus to kind of spread more quickly and rapidly in the entire country. Basically, that's what we've done.
Now, a few of the states in Nigeria are giving 24-hour curfews and whatnot to control what's happening. But also, we understand in the UK, there's several restrictions that are ongoing. Some people are in favor, others are not. What do you think?
There's a kind of three-tier lockdown for Manchester and a couple of other cities like for tier 2 and tier 1. So basically, what the Manchester mayor was trying to push across to the government was that when you do a kind of more stringent lockdown, the livelihood of people is going to be impacted. People's daily routine like work will be impacted. And now is the government willing to release more funds for people to basically stay at home and observe this lockdown. And at the same time, I do bear with people as well because staying at home 24/7 is not really an easy task to do. So basically, will the people actually obey this rule is another angle to look into basically. So I think we're at a kind of crossroad right now when it comes to lockdown restriction and what have you in the UK, basically.
While we're on the subject in the United Kingdom, we understand that it wants to start a human trials, COVID-19 vaccine trials in January. Are you optimistic?
Optimistic, I would say conscious, because it's a human challenge trial. So what that means is that you're going to first vaccinate people, that is people who are volunteered for a particular vaccine, then you then infect them with the virus itself. Now, there are two sides of this particular story. People are of the yes, then a couple of scientists are saying no. Because when you look at the other side of the divide, we know that we're not so aware of what the risk factors are for COVID-19 disease. So if you infect an individual, for instance, there's no safe net for this particular trial. And again, when you also look at the other angle again, where they're trying to put their argument from, they are saying that we need to recruit young people, people without existing life underlying health conditions. And basically, you know that when it comes to COVID-19, it's not selective basically. So it's sort of an homogeneous trial. You may likely not get the needed results you're looking for. Then if you look at on the other side of the divide, we do know that when you do a challenge trial, basically, you have the opportunity to speed up your vaccine research. So you're trying to look at if your vaccine, your potential candidate vaccine, are able to stimulate the required antibody response to this particular disease. Now, basically, when you look at that, it then enables you to move faster to then develop the right candidate vaccine going forward. That is one. Then two, it will enable the world to move at a fast pace. Then three, we know that when you also do this challenge trial, basically, we are able to understand at what point will the immune system be triggered, basically. But when you do the standard conventional trial, where you have people moving around despite they volunteer for the vaccine, what you have is that you allow people to be exposed in the public on the normal circumstances. But basically, with the lockdown we have, specifically in the UK, where the restrictions are a little bit mild and medium, how feasible is it that if I'm given a particular trial today, I'm going to come in contact with people who may be potential carrier for this virus? So basically, we have a sterile environment whereby a standard clinical trial of phase 1, phase 2, phase 3 is neither here nor there, whereas the human trial basically is also kind of trying to speed up what we have at the level of the current clinical trials we have, whereby we're able to understand how this virus works effectively. Now, when you look at the antibodies itself, basically, we do know that at a particular point in time, the antibodies basically dwindle out of the system, basically. Now, when you do a human trial, challenge trial, basically, what dose is required to inject an individual to give the right infectious disease you're looking for? So if, for instance, you give a lesser dose and you fail to challenge that particular immune system to then combat that particular disease, you may have false negative results. So this sort of trials, scientists are still neither here nor there. No one has actually come to a full conclusion if we should go for the human trial, human challenge trial, basically. But
Right.
I think it's
quite an interesting process. All right. Thank you so much. We appreciate your time. Dr. Peter Emuassie, a research fellow at University of Aberdeen. Thank you for joining us.
Thank you for your time.
Meanwhile, the UK is pushing ahead to be the first nation to carry out that. We had told you. They're saying that the trials could begin in January, and their aim is to speed up the race to get a COVID-19 vaccine. Let's bring you a bit more of some of the happenings globally.
Amid plans to carry out human challenge trials, the World Health Organization says the process will be reviewed by an ethics committee. This comes as the UK government says it would invest £33.6 million in the studies in partnership with Imperial College London, Laboratory and Trial Services Company HVIVO, and the Royal Free London NHS Foundation Trust.
So generally with such trials in the past, they were done when you had a specific treatment. So you would expose the person to the virus, test the vaccine in the person who is exposed, give them the vaccine first, actually, and then expose them to the virus. But you would have a treatment. So you must ensure that everybody involved understands exactly what is at stake, must be selected to minimize the risk to the volunteer, and you must ensure that informed consent is rigorous, that they really do understand all the risks.
Meanwhile, outbound COVID-19 tests have been launched at Heathrow Airport, returning results in an hour in an effort to reopen restricted routes for passengers and boost traffic for the airlines that fly there.
The first thing is it allows you to get in, so it gives you certainty before you've left. You know, there's also the rules around it. So actually flying from here to Hong Kong, you have to have a test before you've boarded the plane. So one, it guarantees you entry. For places like Italy, it's about knowing that you're safe before you get on.
Britain is looking at ways to reduce the 14-day quarantine period, which applies to some arriving passengers, using a mix of COVID-19 testing and self-isolation, and a task force looking at the issue will report back in November.
Continue to take responsibility. You can take a closer look at our website. It's channelstv.com. You find more updates on the pandemic. There's several other stories there at your fingertips. It's channelstv.com. Stay with Channels Television, your home for the news, as we bring you the latest in news from across Nigeria and the rest of the world. I'm Millicent Walker. Thank you for watching.